Rule number 11, and man, this is a big one, guys. You must be able to establish priorities. I wish that there was just one rule that I could give you to establish priorities, and you would say, good, everything is fine. Unfortunately, it's not that way. So, depending on the situation, we have different ways to help you think through establishing priorities. One of the big ways is you can only take one action and then go home. Now, when you first hear these words, you may think, well, what is she talking about? But all the way through on this exam, they're going to ask you to discriminate and choose priorities. And one of the ways that this will help you is there's no multitasking on this exam like there is in the real world. You can only take one action and then you gotta go home. So if I elevate the head of the bed and then go home, what will the outcome be? And if you do that through all of your answer choices and determine what the outcome is when you take this one action and then leave, it's going to help you discriminate between several answer choices that you think are correct for this situation, but only one is going to be the most correct. So you can only take one action and then go home. If I go home, what will the outcome be? And then you make your decision based on that outcome. I don't want you ever just looking at an answer choice and saying, yes, I would do that, no, I wouldn't. Because if you want to answer a question that way, you are not engaging in critical thinking and clinical reasoning. And remember, that's what they're testing on the exam. I keep going back to rule number 1, don't I? But it's a really important rule, and it's the reason it's rule number 1. Another way that you can establish priorities is by using Maslow. And you know that Maslow is a hierarchy, and it starts at the base of the pyramid, if you will, with the most basic needs and then moves up. So the most basic needs are physical needs: food, water, air, clothing, shelter, sex. Then the next level is safety and security, which can be physical or psychosocial depending on the circumstances. And then everything above that is clearly psychosocial. So if you have a physical need that makes sense for the client and a psychosocial need that makes sense for the client, the physical need will always take priority. So you're going to eliminate all answers that are psychosocial. On the NCLEX-RN examination, and remember we're talking about the rules of NCLEX now, consider pain psychosocial. Now, I know this runs contrary to what you've been taught in nursing school. They always say take care of the patient's pain first. And frankly, if I'm your patient, I think that's a great philosophy. But it doesn't necessarily get your right answers on the exam. So for just purposes of the NCLEX-RN exam, living in NCLEX between now and the time you go in to take your exam, do consider pain psychosocial. For any remaining answer choices, because you've eliminated your psychosocial answers, you have to ask yourself, does this answer choice make sense? Because sometimes they will put physical answers on a situation and it doesn't make sense. So if something doesn't make sense, eliminate it. And for the last choice, if more than one answer remains, use the ABCs. Now, one of the things I want to point out to you is the order in which we did this. The first thing we did was we determined what was physical, what was psychosocial. We eliminated all the psychosocial. The second thing we did with our remaining answer choices is to say to ourselves, does this make sense? And then the third thing was to go to the ABCs. The reason we put the ABCs last and not first is because I know that you've had faculty in nursing school that really stress the ABCs, and they make perfect sense. You have to have an airway before you can breathe, and you need to be breathing before the circulation. So it makes sense. But faculty who really stress this, what they tended to do was to write ABC questions where the airway was always the answer. Now let's think about What happens on NCLEX? Because they are testing your judgment and your discrimination, they will put airway breathing answers as answer choices that don't apply to the situation. And if you're not thinking, you just go right to it, you pick it, and again, you feel really good about selecting what turns out to be an incorrect response. So be very discriminating about, considering the ABCs. Are they important? Yes, but do them last, not first. Assessment and implementation is another way that you will establish priorities. What they will do on the exam is they will put the appropriate assessment and the appropriate implementation for a particular situation and then ask the question, what do you do first? So you will use assessment versus implementation if your answer choices contain both assessment and implementation. And again, we're going to go over this a lot in class, and we're going to ask you to practice it during phase 3 of your preparation. Critical thinking is about seeing patterns. The more you can see patterns, the easier it is to think through the question. And assessment and implementation is one of those things. So if your answer choices are a mix of assessment and implementation, you need to go back to your STEM and read and determine, is this a situation where I need assessment or further assessment, or do I have all the assessment I need and now it's time to implement? So this is certainly a piece of clinical reasoning that will help you get more right answers. All the way through this exam, they're going to ask you, who do you see first? You are the nurse, you've got 4 phone calls to return, you're working on a floor, you've just received a report, you've got 4 patients to see, who do you see first? They ask these questions a lot on your exam. And again, sometimes it's kind of hard to discriminate between the answers. So what I'm going to do now is give you some patterns that you can look for to help you discriminate between answers. First of all, is your client unstable or stable? You always see unstable patients first. Always, always, always. So that's one way you might look at your answer choices. Unstable versus stable. Another way to look at it, is the problem real or potential? Even if it's a serious potential, the real is going to take priority over it. So you deal with unstable clients, you deal with clients, who do you see first, that have real problems? ABCs is certainly important. Are the patients you're dealing with in your answer choices, do they have acute illnesses or chronic illnesses? An example of this might be if you have a client and maybe the setup is that you're the nurse working in the outpatient clinic, and you have a patient who's been previously healthy, and they call you and they say that they're having trouble breathing and they're expectorating this rust color mucus, versus, okay, you have a client who calls and they're diagnosed with COPD and they're coughing up, huge amounts of mucus too. Well, which one is going to be your priority? Well, you have one patient with an acute process going on and you have one that's chronic. You would expect your COPD to be coughing up large amounts of thick, tenacious mucus. So you wouldn't consider that necessarily somebody that you would see first. But always remember, it depends on your answer choices. Unexpected versus expected. For example, if you have a client who is 12 hours post-op, you would expect some incisional pain. But if you have a client that's 3 weeks post-op and having a lot of incisional pain, you would not expect that. Now, I know I've given you a lot of information here about who do you see first, but I can promise you we're going to go over these questions in class, and also you're going to have ample opportunity to practice answering these kind of questions by using your resources in phase 3.